A very warm welcome to Dr. Karl Max Einhäupl, the chairman of the Charité's executive board. Thanks for joining us on the show.
Hello.
Now, the Charité is an internationally renowned hospital. It's been around for over 3 centuries. What did you say, or what would you say, in which fields does your hospital really shine?
I think Charité is especially important and especially famous for basic sciences, genetic, genomic, and epigenetic. And of course, it's a hospital, and therefore the clinical parts of neurology, of cardiology, of immunology, allergology, rheumatology are one of the strongest. I think oncology and cardiology are growing at the moment, and that's what we plan for our future, to focus on a few areas, the areas I mentioned at the moment.
Now, 7 medical researchers who worked here went on to win the Nobel Prize. Are there any more hopefuls in the wings?
I think that's a real obligation, but what we have to say, to be honest, is that it will not be possible to gain a Nobel Prize winner in the next few years, because you have to mention that Charité has a tradition, the new Charité, in this constitution now, has a tradition of 17 years after reunification of Germany. And in that time, we gained the place #1 in the German science ranking concerning the usual science indicators. But it will take time to get a Nobel Prize winner here. But I hope it will once be the fact.
All right, well, Dr. Einhäupl, please stay with us. We'll be back with you in just a moment. But before we move on to the future of medicine, we'd like to talk to some of the students and doctoral researchers here about their medical dreams for the future.
Medicine should be cross-disciplinary. Doctors need to be able to communicate with one another more effectively and more quickly.
There's no question about it. We have to find a cure for cancer.
We need more research in drug development and those with fewer side effects.
Human interaction needs to be pushed to the fore.
We have to ensure that not just rich Western countries benefit from expensive medicines, but also that developing countries and emerging economies are given more access.
I hope that at some point both medicines and instruments will become cheaper, and that everyone who is sick will get well.
Dr. Einhäupl, if anybody can answer this question, you can. Where do you see medicine in, say, 20 years from now?
I think in 20 years, medicine will be individualized for each person. At the moment, we treat patients with a disease with a certain medication. In future times, probably it will be necessary to treat a certain patient with a certain disease with a certain medication. And I think that is one of the most prominent things we have to do in that Charité and in science, in medical sciences.
Now, with the progression of technology and the use of more and more high-tech instruments in medicine, there seems to be a movement away from the actual human touch. How important is that in a doctor-patient relationship?
I think it's very important, and we try to educate our young students to be both a good doctor and a good scientist and a good natural scientist. On the other hand, I think science is so fast progressing that the cost for science and the cost for medication and the cost for medical care will increase enormously. And I think it's really a very important point to make it suitable for patients in Germany, in Europe, all over the world, and especially in non-developed countries.
Now, specialization is another area that is continuously on the rise in medicine. Could this, however, become a little bit problematic because doctors can perhaps only see one aspect of an illness or a condition?
I think concerning the scientific view, it is necessary. Concerning the medical view, it will be a very important thing that at least doctors in the general practice will have a broad education and will be able to treat a patient not only with a certain disease but with his whole problem.
And just briefly, do you think that one day we will be able to banish illnesses and disease completely?
Of course not entirely, because we become older, and as we become older, new diseases will develop, and I think it will never be possible to really treat every disease.
All right. Dr. Einhäupl, thank you so much for joining us on Tomorrow Today.
Thank you.